Yes, good evening. I'm Françoise Chagnon. I'm from McGill University, Montreal, and I'm here to encourage your interest and feed your curiosity in otolaryngology.
Wonderful. Dr. Contis.
Hi, my name is Theta Contis, and I am in private practice in Baltimore. I have a part-time academic appointment at Johns Hopkins. My medical school was Wake Forest, and my residency and fellowship were at Hopkins. And I am a facial plastic surgeon, and I look forward to answering your questions about that.
Wonderful. Dr. Parikh.
Hi, good evening, everyone from Seattle. I'm Sanjay Parikh. I'm a pediatric otolaryngologist. I work at Seattle Children's Hospital, and I'm also on faculty as professor at the University of Washington. I'm also on the admissions committee here for residency. So I'm thrilled to be here. Thank you, Dr. Lindeman, for hosting this, and I look forward to interacting with the other panelists.
Certainly my pleasure. And last but not least, Dr. Randolph.
Hello, everyone. Welcome. I can't tell you how excited I am for all of you to consider otolaryngology head and neck surgery. It's a wonderful, wonderful field. I went to Cornell undergraduate and medical school, and now I'm at Massachusetts Eye and Ear Infirmary and do primarily thyroid surgery. And I'm now the Bertucci Chair of Thyroid Surgical Oncology at Harvard Medical School. Welcome.
Okay. Well, I am so looking forward to your answers to the same question. I'm going to kick it off the same way. I would love to go in turn. Why did each of you decide on otolaryngology as your specialty of choice? And at what point in your career path did you develop your interest in otolaryngology?
Well, I ended up in otolaryngology because I couldn't master head and neck anatomy as a medical student. That was one of the biggest challenge. So I said to myself, I'm going to really work at this. And I knew I had an act and I wanted to be a surgeon. That was one thing. So I did enter into this field for that reason. The second point was that I decided I was going to do a rotation, elective rotation in it, because otolaryngology I felt would give me a lot of practical knowledge. I mean, ear, nose, and throat problems are ubiquitous, and everybody comes to you as a doctor. Your family comes to you with these various ailments. So I said it would give me some good practical knowledge should I continue in this field. My third reason also was that I did express a fascination for the human larynx and the voice and the vocal cords. This was at the beginnings of endoscopies and so on, and I was just really fascinated by that human physiology, which I eventually ended up doing as a subspecialty with phoniatrics and care of the professional voice.
Wonderful, Dr. Contis. I think you said already that you're a facial plastic surgeon, but tell us a little more.
I am. Well, I would love to tell the medical students that I plan to be an OBGYN, and I was sure that was what I was put on earth to do. And then I hated it in third year of medical school. So really, in your third year, you really find your people. And my people were the otolaryngologists. I knew I wanted to be a surgeon, and otolaryngology had so many different types of surgery. You could work on the ear or the larynx or the face. And so the whole residency was just fun. But then I found my niche in facial plastics because I love making people feel better about themselves. And it's really, I think that the students are going to find that each of us has such a passion about what we do that we can't understand why anyone does anything else but why we do what we do. So you do eventually find your passion, and just helping people look better and feel better is my passion.
Fantastic. Dr. Parikh, what was your reason for otolaryngology and when?
Yes. Well, it was a sort of it wasn't an instant moment. It took some time to figure out this was for me. I was in my first year med student. As a first year med student, I did love anatomy, and we were very lucky at my medical school that the residents in otolaryngology actually had to rotate. The junior residents rotate as anatomy instructors. And so I interacted with these residents that were also going back to med school to practice the anatomy, and they were doing advanced parotid dissections and so forth. And I was like this starving, excited med student, couldn't wait to see more of this complex anatomy. And I just loved it. I liked the little finicking, and it seemed like a cool field. And then I did some research, elective time in it. And then I just fell in love with the personality of the people in the field. And I also am very grateful. There was a mentor, a resident that mentored me in that early medical school phase. And I'm still friends with that mentor now. And whenever I see him at meetings, I thank him because he introduced me to this field, which I love so much.
That's wonderful. So often it all comes back to mentorship, I think, in so many people's stories. Dr. Randolph, why otolaryngology for you?
Yeah, Dr. Contis and I have a very similar pathway. I was pretty sure OBGYN reproductive endocrinology was the thing that was going to be for me. And then I did a rotation, and actually with Roy Sessions at Memorial Sloan Kettering. So again, a mentor. And he introduced me to the thyroid gland, and I fell in love with the neck anatomy. And I thought, well, I have this neck anatomy, and now I even have a gland, so I can give the corpus luteum up. I've found where I need to be. It was the right blend, and it was, as everyone has said, a combination of the neck anatomy, or the anatomy of the head and neck, was one of the major pulls. And also another theme I think that you've heard in all of these stories that I would also validate, because I've talked to many people about why they went into otolaryngology, but is when we first bump into otolaryngologists, they're smart, they're doing really cool surgery with really amazing anatomy, and also they seem happy about it. They seem to be enjoying themselves. And that is a very universal commentary. You've heard a little bit of that in all of the comments made thus far. And that, that told me something, that I thought, well, I'd like to be doing really cool surgery, and I would also like to be happy. And I certainly have been.
Well, that's wonderful. There's a question in the Q&A that I will come back to, but I thought maybe to cue that up a little bit more, I would love to hear, and many of you have perhaps alluded to this, but what are some of the best things about otolaryngology, and what are some of the maybe not so great things?
I'd say one of the greatest aspects of this specialty is the great diversity. There are many subspecialties you can explore, but as a primary specialty, I mean, it's quite diverse, not only in the types of diseases, but the clientele. This crosses all age groups and all walks of life can show up in your office within one day. So I think that keeps us from being bored. I think it's true that most otolaryngologists is very happy because it keeps you very curious and on your toes constantly. And it's quite challenging as a clinician. You have to be first and foremost a good clinician, even before you're a good surgeon as an otolaryngologist. So I think that keeps you very enthused. So that's a big challenge. And then again, it's a field where you have to be a jack of all trades, and I'll say a master of some. You may not be a master of all of it, but you do have to attain a certain mastery of most of the subspecialty aspects, despite you wanting to be a general otolaryngologist. I think that's still the greatest challenge, is being a general otolaryngologist nowadays. So overall, I don't see any negative aspects to the specialty, other than, as I say, you have to be on your toes and still maintain that being a jack of all trade and a master of some.
Does anybody else want to weigh in about that? Yeah.
Yeah, I'd like to chime in. I think where I work, I love what Dr. Chagnon said about the diversity of the work we do. I always tell people, people travel the world to see the planet. I get to sit in one place. There's a parade every day of things. It's really fun. And I think the other thing I want to point out that I love about my job is sort of the multidisciplinary model that most of us work in. It's great to be part of taking care of complex kids with complex teams. And that really fulfills me. I do want to speak to some of the challenges that I think otolaryngology still has, and this group that you see here are leaders that are working on this. But We still need to work on wellness in our specialty. I think that many of us maybe are working on the work-life balance, and intentionally. And I mean, I think it's not just otolaryngology, but many fields. I know I sometimes I'm on the wrong side of that balance, and I'll declare that openly. I'm working hard on that. I have 2 kids that are 10 and 12, and they really keep me grounded, make sure I spend as much time at home as possible. But there's still moments where sometimes I think I'm putting a little bit too much on the wrong side of that pendulum. But I'm trying and getting better at it.
That's great. And I'm glad
Vanessa,
you addressed that. That's the question that was in the chat, is if anybody could speak about work-life balance within the field. But please go ahead, Dr. Randolph.
Yeah, Vanessa, Sanjay's comments were, I think, important, very important. I just wanted to mention just something that seems to occur to me during the day is that we operate in a surgical field, which can be challenging. There is a cranial nerve, or several of them, ramifying the field of our routine surgical field that we endeavor to preserve for hearing, for voice, for swallowing, for facial function, and so forth. And you can get better at that surgery, the thing you do daily with your hands, and then you can see the success as you see your patients postoperatively. For me, this is a normal calcium and normal voice, to being a thyroid surgeon. And that repetitive getting better at it every day, and seeing the success that you have in your clinic is addictive and is a recipe for a very happy life. Theda kind of mentioned that a little bit about, people with issues that they want managed that she can make better. And then she sees them afterwards and those things are better. That's a very good way to have a career.
Well, thank you for mentioning that. My favorite time at work is when I show someone their before and after pictures, and I get almost more excited than they are about their results, because I help them achieve that. And we all go into medicine because we want to help people, and people can't see their thyroid, but they can see their scar. So to help people with their appearance, for me, is at this day and age very helpful. As far as work-life balance, I think the millennials have it way over us. Our generation, we're the type of people that say, oh, I have 600 sick days that I haven't used. And the younger generation thinks that's nuts. You use your sick days, even if you're not sick, you need a mental health day. So I think our generation's not so good at work-life balance, but otolaryngology is a great field that you can achieve work-life balance. It can become any type of career you want. If you want to do free flaps, big head and neck reconstructions, and be there all night and never take a break, you can do that. And if you don't want to operate, you can do allergy. And anywhere in between. So I think as a surgical subspecialty, it's really a fabulous field.
Okay, well, I think it's clear that there are some in the audience that have consumed the Kool-Aid and that are very interested in a career in otolaryngology. And so if you are to advise those individuals, they're curious if you have any recommendations for non-otolaryngology electives that are helpful as you may pursue or enter an otolaryngology residency. One example that was given was an anesthesia elective.
Well, I think that is true, anesthesia elective, so that you become more confident in managing the airway. That is a fundamental skill in otolaryngology, is primarily management of the upper airway. But I'd say what electives could help you through the residency would be to do some electives. I'd say radiology, again, to master the anatomy of the head and neck and understand some of the interventional radiology. That's an expanding field. I'd say also anything to do with allergy immunology. We're having a lot more immunotherapy coming down the pike for oncology and head and neck. So that's an allied field that's very interesting. And of course, you could easily do also some neurosurgery if you're particularly interested eventually in doing otology, rhinology, and so on. So what I'd say, give some emphasis a little bit to these other electives and disciplines that'll give you the some foundation, to help you during your rotation. Lastly would be obviously infectious disease, microbiology, infectious disease. If you can master that, it'll help you a lot throughout your residency.
I don't think Dr. Chagnon left anyone out, actually. That's really
A
good.
little bit of everything.
Well, I
Never
might
choice.
throw in dermatology and maybe ophthalmology also.
Okay, well, and to that question of related fields, what advice would you give to students that are debating between other fields that, may operate in similar areas or cover similar diseases? So fields like neurosurgery or ophthalmology, things like that. Any advice for how to
I
choose?
could make a brief comment on that because I was considering neurosurgery. It sounds kind of chaotic, OBGYN and neurosurgery, but I was certainly considering neurosurgery. But then I thought a little bit, and this is something that everybody really needs to don't go into a field because your father or mother says, or because your partner says. Look at yourself and think, what really makes you angry during a day? What really satisfies you? Not what you think, but just really the way you are, and try and figure out a career that will be the best pathway for you. So I thought, well, I don't mind being hyped up on call, but if I'm a neurosurgeon, there is never, ever, ever going to be a mellow night on call. It's always going to be hyper acute. And I thought, I like that, but I don't like that all the time. And so I was honest with myself and I thought, but the neurosurgical call is going to be hyped out of your skull all the time. And I don't think I'm going to enjoy that. Now, maybe that's the truth or not, but that was the thought process I had. The bottom line is try and insert a little bit of your own honest personality. What angers you, what pisses you off, what makes you happy, and then figure out would otolaryngology be the best way to kind of manage that? With what Theda was just saying about all the different ways of operating on big open surgery, operating not at all with allergy, working only with children, working with geriatric problems, all the different things. There is undoubtedly a section of otolaryngology that you would find appealing, but figure out what blends best with your own personality, I think, is a good idea.
If I can add to that, I was considering plastic surgery when I was in med school as well. And I think for me, it was reflecting on the people, trying to mirror myself in the environments that I guess not really mirroring, but projecting myself with the teams I worked with. Was my personality a match for plastics? Was it a match for otolaryngology? And it just seemed like over and over again, I just liked the people I worked with in otolaryngology. I mean, that doesn't mean that I don't love all my colleagues in plastics, but just my personality, who I was, seemed to match better with otolaryngology. And that's what differentiated and led me in this field.
I'd say, I think you're right, Dr. Randolph. I had two uncles who were obstetrician gynecologists, and I did not want to go in that field. I mean, I was petrified of obstetrics. Then again, my father was a businessman, and he said, otolaryngology, that sounds pretty good. There's no recession in that business. I think that what engaged me was the possibility of, again, relating to many types of patients and many types of diseases all in one day, and that there would be a good mix of, bad news and good news, serious disease and not so serious disease. But for each one, I could probably make an impact and some improvement in their quality of life and their well-being. And that would keep me balanced to have, good days and bad days and bad days and good days. And I'd say it's a bit of surfing. We talk about balance. Well, most of the time it's like skateboarding. Most of the time you're balanced, but sometimes you fall off. So the work-life balance is not a daily thing. Perhaps you can achieve that. But for me, it's, you try to have a somewhat of a balance in a period of time, but it's not necessarily a daily occurrence. And you don't get discouraged about that if there's some days, some rush days, periods where you don't have that balance, and other times you're back surfing pretty good.
Yeah, Francois, that's something also I think that I've heard many, many times before, is that otolaryngology provides you with success, but a range of success. Some life-changing, keep the patient alive success, and other successes like, oh, I can hear better because now my cerumen is cleaned out. So if you're okay with a range of types of successes, this is an awesome field, because you can both save the life of an individual on a regular basis, or make them more beautiful or handsome, or clean the wax out of the ear so that they can hear their grandchildren's voice. So that's all good stuff,
And you don't even have to be a subspecialist in otolaryngology. You can just be a plain old ear, nose, and throat otolaryngologist, and all day you see different things. You may see a nosebleed and clean out some wax and see someone who's hoarse or someone who's dizzy. And as you said, we're a jack of all trades. So it's fun to have all that knowledge. And you don't really get bored because it's always something new coming in the door.
All right, I want to transition us just a little bit now to thinking about specific advice for people that are interested in applying into otolaryngology. And so if we think about the student that has committed early to the ENT pathway, what advice would you give to that person to best prepare themselves from an early standpoint? And the mirrored question that goes along with it is, as they're trying to seek out research experiences, how do you weigh out getting a whole bunch of papers on your application versus doing one project that's really interesting and meaningful? How do programs weigh that out?
Well, I don't have a specific answer to that. I'll just give you a general one that I think when you present yourself to an interview, whatever you have done of your background, but you're going to have to share some vision as to where you think that this specialty is going in the future. What's coming down the pike, whether it's molecular biology and certainly technological developments and what it's going to bring to our specialty. You have to have some insight of where you want to bring this specialty, because you're going to be part of the future. Whether you're a general otolaryngologist or a subspecialist, we're all going to work together to bring the art and the science of otolaryngology forward. So you got to develop some kind of a vision. I think that could be convincing that you do have a passion for this field. And then what you've done in the past to feel that, to nourish that vision, I mean, that could be very, whatever opportunities you had, it can be very diversified. I'd say also to prepare yourself for the interview, scan quite a bit the big journals of otolaryngology, see where the hot topics are, see where the controversies are, so that you could perhaps engage somewhat in that discussion with a critical mind.
Other thoughts?
I don't,
Preparing yourself early.
because I'm part-time academic, I'm not someone who's interviewing medical students for residency, but I would advise you to just keep an open mind in your residency, because you just may be surprised which direction you take in the field. You may want to be a general otolaryngologist. You may want to go out and practice in a community somewhere, or you may want to be the thyroid surgeon who does scarless thyroidectomies, so having a vision, as Dr. Chagnon said, is just so important, and just have a passion about what you do. My guess is that interviewers are more concerned that you understood the research and were passionate about it than had 15 or 20 papers. So that's my suggestion.
Maybe I'll add something as being on the selections committee here at University of Washington, that I would say that there's many programs in North America, and each one has its own personality. Some are much more clinically focused, and some are more research focused. And probably the personality you have and your interest in research will help you navigate which program may be a better fit for you and your career goals. Our program has an NIH T32 grant, so all our residents do a minimum of 1 year extra training of research, either clinical or basic research, or 2 years. And so we actually emphasize research in our application process because it's part of our personality. But I think every program has a different personality. So when you're asking a question, well, should I do one meaningful paper or several? I think that the people on these committees will recognize like these reflect your personality. Maybe you're more interested in several different things and you explore them. But if you have a meaningful time a year in a lab where you get one incredible article, you can also share that somehow through your application. That really means something. So it really depends on your personality and what you want to present and share with us when we look at that. Because I know I take all that I look at that all very carefully when I go through applications to see not just what their research is, but who their mentors are. And does the statement line up with their passion in that arena if they're really truly interested in being part of our sort of research philosophy here.
And then to follow up with what Dr. Chagnon had described in terms of articulating a vision for where you think the field is going, I think maybe a follow-up question to that is, so where should we point students in the direction to begin to get an idea of this? What journals should they be looking at? What meetings should they attend, et cetera?
If I had to start again in this specialty, I would ally myself with biomedical engineers. I mean, to understand technology development and applications and integration in the clinical practice. It's a totally different field. It's very parallel, but boy, we really need engineers. We're going to need also more artificial intelligence to develop clinical research. I think that's where it's going also. And there's going to be impact of all of this technology on our ability to deliver, telemedicine, teleotolaryngology to service, austere environments and, regional areas. So I think there's a vision to develop there.
We have a meeting called COSM, the Combined Otolaryngology Spring Meeting, that is very research focused. And I think for students and residents, it's probably the nicest meeting to go to. It's not as overwhelming as the big academy meeting. And it would probably be a nice initial meeting for someone interested in otolaryngology to attend. And that's going to be in person, I think, this year.
Exciting. Other thoughts?
The Academy, the American Academy of Otolaryngology, has a young physicians and fellows and residents section. So they have groups, subpopulations of individuals that are focused on some of these early career kind of issues. And there is even a medical student grouping, interest group within the American Academy of Otolaryngology. So you can reach out to any of us and we can put you in touch with those folks to get up to speed and hook in with others like you that are at about the same stage, and then end up going to COSM, as Theta says, or the Academy meeting, or hooking up with people within the Academy. It's a good structure to latch on to.
And it's just to add something to read for an interested medical student. There are actually publications in our journal called Otolaryngology and Anesthetic Surgery, which is from the American Academy of Otolaryngology and Anesthetic Surgery, which focus on residency applications, trends, and workforce issues. So there's actually good literature for students to look at it, sort of what is the content of successful applicants, what trends are, what scores, and how many applicants there are. It could be interesting for you to look at that. And I think it could add to your sort of knowledge about where our field is going.
Great advice. Probably that more specialties should take. We have just a few minutes remaining. I wanted to get to one other question from the Q&A. Do any of you have advice for students that hope to practice in rural areas rather than the kind of large academic centers that most of us train in?
I think there's a great need for surgeons and otolaryngologists and physicians in general in the rural areas, and it may sound daunting, but I think that what we're living now, the pandemic and developments of telemedicine and telehealth and so on, is going to make leaps and bounds, and probably eventually robotic surgeries and distance types of assisted surgeries. I think it's going to help very much development of rural medicine. So be fearless. I think there's great opportunities there. There's great need, and probably a grateful population that is awaiting you.
I just like to comment, I'm part of the Washington State Society for Otolaryngology, and so I have the privilege of meeting some of the surgeons that refer patients to us that work in some of the rural communities, and what I hear from them is incredible job satisfaction that they get to do the whole breadth of our field. So many of us are subspecialized into little pockets, but here are folks that get to practice the entire breadth of our field and get to see all that challenges that and get the rewards of taking care of all these aspects that they can. And and they get to live in a community where the cost of living may be a little more reasonable than some of what we're seeing in the bigger cities. So for all those reasons, the surgeons I meet from rural communities are actually could claim a pretty high quality of life.
Okay.
It is generally a happy field. We do see some head and neck cancer, obviously, and the treatments are getting better, but it really is a happy field. We do help people hear and talk and look better. So I think that's also how we kind of find each other. We're sort of nice, happy people as a group.
May I add a comment? We haven't mentioned the needs of the performing arts. Performing artists, may they be in the theater, singers, musicians, they need us. And they very much want to have a good otolaryngologist as partners to develop their craft and to keep them healthy. It's a very nice clientele. They're very grateful, and we can make a great contribution to their success. And I think that also makes us very happy to support the performing arts.
Fantastic. So a couple of questions popped up here that relate a lot to changes with the residency application process. Can anyone speak to how your program may be preparing to address the change of USMLE Step 1 to pass-fail scoring and when that may be implemented for your incoming trainees?
I'm happy to take this one too. I'm actually kind of excited about it. I think that that USMLE scores were identified across all the different scores. There may be bias in sort of how the outcomes are based on the school you go to. And so I think we're going to be looking far more at dean's letters and other signs of performance during medical school. And so there'll be more work, I think, for us to be sifting through the application to no longer just look at a score as a benchmark, but to look at the package as a whole. So I think we'll be looking appropriately at other aspects, looking at your dean's letter, looking at your reference letters, looking at your research history, your core statements. All those will now sort of percolate higher in importance. And so I think it's actually going to be a good thing that we drift away. I also think that, here in Seattle, the culture of applications moving away from in-person to Zoom may be effective for us too. It's very expensive to fly here. I think this promotes a more equitable options for all our medical students to have an access to all of us to see different programs virtually. I know that might not be a popular opinion, but for me, I think it's probably the way we're going. And the last couple of years, we've managed it. We've managed it, and it's gone okay. But there's a massive expense savings for medical students too. I mean, some take out loans to travel nationally to go to meetings, to go to these interviews. And we have to respect that as well. So I think that we're going to be okay without the USMLEs.
Yeah, I would just say that in Boston here, it's really more about the person, more about the human than 1 point higher on a test. And so I think my advice to people with application in general and applying is be a legitimate, moral, all into otolaryngology team player. That's the sort of person we want. Obviously, you have to have the intellectual horsepower and demonstrate that. And I know all of the applicants have done that. But it's the person that's being interviewed, not the score. And so that really is the message that comes across, frankly. I mean, don't think it doesn't. Also, one thing is some people have, as I did at least, not the most straightforward pathway. Sometimes you went this way and sometimes that way. And it is important in your application, in your essay, to provide what is the story of you. In other words, how do we get a handle on you? How do we understand you? What makes your folder different than everybody else's? How do we explain those good grades, but also those bad grades, or that time off, or that research project? Give us an explanation, provide the story, so that it's easy for the people reading your folder to say, oh, this is the woman who did this amazing research, but also she did research in horse physiology. And the reason she did that is because her family would, like, put it together in a way that you can understand all the fluxes in your life. And that is also, it's being honest. It's telling about you as a person. And that honesty comes across as a very strong message.